And good morning. As I always like to say, it's a pleasure to have Karen in with me. Karen Onan is a part of and kind of the hoo-ha for East Central Regional Transportation Coordinating Council when it comes specifically to that transportation piece. And Karen and I have been talking for several months here with a variety of people that represent different aspects of transportation in our area. Karen, I appreciate your time as always, and you're back in today. How are you doing?
I'm doing great, Robin. Thanks for having me on again. And we have a great interview. We have Erica Bliss here with us from the Kanabec County Veteran Services. And I just want to say hi, Erica. It's good to see you.
Hi. Yeah, it's great to be here.
Would you like to share a little bit about who you are, what your background is?
Sure. I'm Erica Bliss. I am an implant. I'm originally from Iowa. Left for the service when I was 18, U.S. Army. And when I came back, came back to the great state of Minnesota, and I've been here ever since. Married to a combat veteran, 4 children, and my oldest is also an Army veteran. So
Wow.
A lot of veterans in my family and very happy to serve.
And she does an awesome job, Karen. I've had the pleasure of doing some interviews specifically with her about different things that are going on, helping out our veterans in the area. So she does just a fantastic job. To serve in this position, you do need to be a veteran, correct?
It is a qualification to be eligible in the state of Minnesota. You have to be a veteran.
I think it's good to get some background here, Karen.
Mm-hmm.
You know, within your position, what all do you do? Some people might not really know what all it encompasses. At least give us a little, elevator speech on that.
So I try to tell my veterans that I want to be a one-stop shop for them. So under the VA umbrella, there's lots of different things. There's healthcare, there's education, there's disability claims, compensation, there's burial, so the cemeteries, things like that. So there's a wide gamut under just the VA umbrella, of which I am not a VA employee, but I do help veterans get those benefits. But then there's a local emergency grant that helps veterans in need. The state of Minnesota work really closely with them for different programs. So there's just a wide variety. So if you're a veteran and you served honorably and you have questions about any kind of benefit, reach out to our office because chances are there's a program that'll fit your need.
And of course, transportation is a huge issue for so many folks in general. And then certainly you have your veterans that you want to help. Give us a little bit idea how that all works in your piece of that.
Our piece of the puzzle for transportation is small. It works well for the veterans who qualify, but again, we don't reach everybody. We have a DAV vehicle. The DAV purchases a vehicle and they donate it to the VA. And we can provide transportation with our volunteer drivers to VA contracted appointments. So if the veteran has a medical appointment at one of the VAs or a CBOC, one of the community-based outreach clinics, or if they have a contracted appointment in the community, we can take those veterans there. So there's a gap in services. You can tell right now. We can get them to VA appointments, but we can't get them, to the grocery store. Or if they have an appointment down in the metro area or outside Kanabec County that is not a VA appointment. And there's lots of veterans who don't use the VA for whatever reason,
right.
But then we're not able to transport them. We do have a gap in services. And we also have a gap as far as transportation. If they are wheelchair bound, then that doesn't work well in our vehicle. So then we struggle sometimes to coordinate the handicap piece or if they're wheelchair bound or need that level.
It's something you'd like to see, expanded.
Do you have a connection with timber trails at all? Would they help fill in any of the gaps? Would that be something maybe we could discuss? Because most of the buses, the public transit, are ADA accessible, and the bus drivers are very helpful with that. But then I'm sure there's other issues with the first and last mile to get the veteran then to the bus services if they're outside of the range of the public transit. I know that's a huge thing.
And that has been a gap. Yes. So I always reach out to timber trails first, and then I've worked with public health or the social workers at the hospital in particular have given me some other resources, and we're trying to map that all out. And sometimes it's the family members or caregivers can no longer get them in and out of the vehicle. And it's so individual per veteran, and it varies in time. So
well, this is part of what the RTCCs are working on is finding vehicles, the accessible vehicles that are not being utilized, and possibly then putting them into service, such as, and I don't want to throw anybody under the bus, so to speak, but Tim Schmutzer from Phase has always been interested in sharing their vehicles, and the insurance issue is a part of it, but they are all ADA accessible vehicles, and if those could be pulled in and find the drivers, they could maybe help fill those gaps. Oh, this is interesting.
Is volunteer drivers a big piece of that?
Well, that's an issue.
Yeah.
I mean, we don't have the volunteers right now, but maybe there are some that are veterans who might be interested in volunteering if they had that vehicle to be able to drive and then help their fellow veterans get to the public transit or take them all the way to where they need to go. I wish that we could help you get an ADA accessible vehicle, because that just seems to really fit.
Yeah, I think that's definitely in our future. We'll have to start crunching numbers and things like that and see if grants are available. But again, you have to have, we'll have to look at the county liability. There's just lots of things
of stuff
to look at,
consider.
but it's definitely a need. But again, it's sporadic too. And when you're proposing those things, statistics we're really heavy on those, aren't we?
Oh, I know. I'm going to check into the 5310, 5307 vehicles that are available out there through MnDOT and see if there's anything I can do to find. Because, we have to help. And I've got some connections here. I'm learning a lot right now. And thank you for that, Erica. See what we can do to help you.
I've talked to several veterans in the area, and some of this is knowledge, too. I was talking to a particular gentleman, and he needed to get down to, I think it was to Abbott, right? So we were talking about the different facilities, and his wife was not going to drive in the cities. And in that particular situation, he didn't know about any of the things that Karen and I have talked about with other people, what the availability is. They're willing to spend the money. It doesn't have to be a paid-for situation for a vet. Sometimes just understanding that, hey, for $30 you can, whatever the cost is, if their significant other doesn't have to drive them, that's all they're looking for. They're not aware of the services, and that's one of the reasons Karen and I are talking month after month about some of these concerns. And I'm sure as these pieces fall in, even if it's not specifically under what you do, Erica, you will have those resources and connections. That's all. This is all kind of coming together in real time here so that Erica knows what else can happen too.
Yes, and the breaking down of the silos, as we've talked about before, where you have certain bus services where they don't connect. Right now, the RTCCs have all of the public transit services at the table that are in our region, would take you to St. Cloud, would take you to Minneapolis. Well, Minneapolis, you're working with the Met Council. But Arrowhead right now is working with the Met Council to get through to be able to take, people down into the Twin Cities. And Arrowhead will take you up to Duluth. So we just need to make sure that we know where our gaps are. It takes a while because MnDOT doesn't move really quickly, but to put together these service plans that these public transit providers have, if they know where they need to do, and we've got people behind it, and especially like MCOTA, the Minnesota Council for Transportation Access, we can make these things happen because, like I said, these silos were built, and now we need to break them down, and which is what we're doing right now.
Yeah. Mention again, Karen, 2 quick silos. I'm thinking of somebody maybe hearing this discussion for the first time.
Well, when we talk about silos, what I'm talking about is if you think about a silo, it's got a boundary all the way around it. So you've got, say, Timber Trails Transit. They are in a silo because they're only able to service Mora area and 10 miles outside the Mora area. So you put that boundary around there and you put those walls up, they can't go outside that. And same with TriCap over in the Mille Lacs area and Arrowhead. But, we're starting to break those silos down so that this transportation can connect. Really the communication, and that's what the RTCCs are, Regional Transportation Coordinating Councils. That's why we're here, to connect everybody, us with the Veteran Services Agencies, with the NLX, which we'll be talking about in a couple weeks. NLX meaning the train services. What can we do to connect everything together? That's what transportation is.
And Eric, I wanted to ask you too, because I know you have some wonderful volunteer drivers.
We do.
And But I know that's something we talk about almost with every different group is the need for that. So make your plea. What do you want to say?
So we do. We have a great group of volunteers. Summer's always hard because volunteers take vacations too. And I kind of want to talk about one of those gaps just for a second. With Pine County Veteran Services, they have a transportation program. I'm not sure the dollar amount they charge their veterans, but that's how they keep their program going. But on several occasions, I've had veterans who were able to get over to one of their pickup spots to get them to the appropriate VA. Same with Mille Lacs. They use the DAV van like we do too, and sometimes we can coordinate to get there, to get to that next step. So there are those missing pieces and little gaps that we try to coordinate on our own too. It gets a little more difficult, obviously, with the handicap because none of us have access to that outside that silo, right?
Yeah.
That 10-mile boundary. For volunteer drivers, I will be doing a training at the courthouse, and I don't have a date for that yet. I need to see how much interest I have in it.
Sure.
During COVID, the VA went to an online virtual training, so I'm able to provide that to anybody who's interested. They would still need to go to the VA because a physical is required, and they have some other requirement to get that volunteer pass to drive our veterans. So I'll tell you more about that when that training comes online. But again, I'm just kind of searching for interest. We have a great group of volunteers right now. You do not need to be a veteran. Some, that's just their way of giving back. They didn't serve, but they want to serve those who did. If you're interested in being a volunteer driver with the VA in our DAV vehicle, please contact our office, and I can get you more information about that.
So they would use the DAV vehicle?
Correct.
Okay. Often volunteer drivers will use their own vehicle, but this way then the wear and tear is on the DAV vehicle.
That's correct.
Yeah.
We don't have any out-of-pocket expenses in the county when we use the DAV vehicle.
Nice. And it's a nice looking vehicle.
Yeah.
too.
It's a nice vehicle and has great logo on the side. You know exactly who it is.
So what does DAV stand for?
Disabled American Veterans.
See, I just wanted to make sure that we had that acronym laid out there a little bit. I know we're looking for volunteer drivers, of course, as well. Anybody who would like to be able to drive. And all of our public transportation services have volunteer driver services, but they are only to medical appointments and things like that. So we are looking to build a volunteer driver service that would take people to the grocery store or wherever they need to go, visiting friends, getting out of the house. So it's difficult. But if you want to be a veteran volunteer driver, how would a person get in touch with you, Erica?
They can call our office, which is 320-679-6380. Stop by. If you have access to the internet, you can go to our webpage. Just Google Kanabec County Veterans. All the information's right there for you.
Would you say your phone number one more time, please?
Sure. 320-679-6380.
Great.
Perfect. And I would say to you, Erica, beyond the time talking about transportation, anytime you want to chat about something, you just call me because I really want to help any way I can too.
No, I really appreciate that. And I should have, because can I just do a little
Absolutely.
thing? It's Suicide Awareness Month in the VA system, and we have been impacted recently by a veteran suicide, and one is too many, but the national average is 20 a day. And just to get the word out there, we recently had a seminar, a workshop for outreach, educating the community on how to ask the hard questions. Are you suicidal? Do you have a plan? Those words aren't going to make anybody think about it. If they're already thinking about it, it's going to make them, hopefully open up a conversation where they feel safe saying that, yes, I do. We can get them help. And it was not well attended. I'm going to guess it's because it's hard. It's hard to talk about.
Yep.
But if we don't talk about it, the stigma remains, right? And we got to break down silos, break down the stigma. So if I can say anything about that, and not just veterans, anybody who is in need, and you want to know more about asking the hard questions and getting in a position where you feel comfortable, start the conversation. You can come into our office. We're happy to start that conversation with you. We can provide lots and lots and lots of resources.
Yeah, I'm glad you mentioned that.
Yeah.
It's very important. Anything else, dear?
Well, I just want to thank you, Erica. You are very kind and very easy to talk to. And if anybody is interested in meeting with Erica, she is at the Kanabec County Courthouse. I would like to ask the listeners to participate in a survey. It's a short survey. If you are utilizing public transportation currently in our region of Pine, Isanti, Chisago, Kanabec, or Mille Lacs, would you please go onto our website, eastcentraltransit.com, and take the survey, because your voice needs to be heard, and we need to know what you need, what you're missing, what you like, what you don't like. And it's a quick, easy survey, and the link is on the website. So fill it out, and please help us to help you to understand what your needs are in our region, so that we could share that with the public providers that are here and listening.
Sounds good. Well, Karen, as always, a pleasure talking to you. And Erica, you know how I feel about you.
Yep.
I love you, girl. Thanks for all you're doing. And I want to thank MnDOT as well. They partially fund these get-togethers.